Healthy Liverpool is a plan to help more people to stay well for longer and provide the very best treatment and care when it's needed. Hospitals are a key part of the local health service. We want to make sure that people who use Liverpool hospitals have access to the very best services, wherever they live or are treated in the city. Liverpool has a number of different hospitals, and while they provide some excellent care, there is also duplication and standards can vary. Local doctors and nurses believe we should do things differently to improve care and make sure that services are sustainable for the future. They're developing proposals to bring teams from different hospitals in Liverpool together to provide single services for things like cancer, stroke and cardiology. This would make it easier to share expertise and training, attract the most talented staff and meet the highest clinical standards. These single teams could be based across different hospitals or clinics, or together in one place. It would depend on what makes the most sense for each individual service. We could also see more specialist care and treatment happening outside of hospital, closer to people's homes, with hospital specialists working in partnership with GPs and other services to share skills and provide the very best care for patients. At the same time, a new health campus is beginning to take shape on the site of the new Royal Liverpool Hospital, where the new Clatterbridge Cancer Centre will also be located. It will be a focus for research and development, helping attract new investment and clinical expertise, and creating opportunities for cutting-edge treatments and clinical trials, which will benefit local patients. Proposals for teams from different hospitals to come together have been in development for a number of years as part of Healthy Liverpool. We've already had conversations with the public about the need for change and the benefits it could bring, and now we're ready to start sharing more detailed information about what this might mean for patients and ask for your views. Our first proposal is about a single service for orthopaedics in the city. Orthopaedic services are used by people with injuries and diseases affecting their bones, joints, ligaments, tendons, muscles or nerves. They include both planned procedures that are organised in advance, such as hip and knee replacements, and also unplanned procedures that are carried out as an emergency, for example when someone is hurt in a car accident or has a bad fall. In Liverpool, orthopaedic services are currently provided by two separate teams, at Aintree University Hospital and the Royal Liverpool and Broad Green University Hospitals. Orthopaedics doctors believe that in the future they should become one team, working across the three hospitals. This would involve separating planned and unplanned procedures so that they happen on different sites. At the moment, patients needing planned operations that have been organised in advance go to either Broad Green or Aintree. Under these new proposals, this type of care would only happen at Broad Green. Aintree would focus on caring for patients whose operations are not planned in advance and need to happen straight away. Aintree is the major trauma centre for Cheshire and Merseyside, which means that it cares for very seriously injured patients from across the region. At the moment, patients with less serious injuries are taken to the Royal, if that's the closest hospital. Under these proposals, ambulances would take all orthopaedic injuries, not just the most serious, to Aintree, even if the Royal was nearer. Creating a single orthopaedics service for the city would mean that individual doctors could be more specialised. This would mean they would treat more patients with the same condition. There is strong evidence that patient care is better when doctors carry out particular procedures more frequently. Information from other dedicated planned care units shows that patients stay in hospital for less time in these types of centres, have shorter waits for surgery and are less likely to have complications or be readmitted. The proposals would also help ensure that local services meet current and new national standards for orthopaedics, which would improve care for patients and reduce the risk of some specialist services being moved out of the area to other hospitals which can meet these standards. The single service would be better value for money, as it would remove some of the duplication that comes from running the same service at two different hospital trusts. It would also help address existing staffing problems. A single orthopaedics service would also pave the way for closer working between other teams at Aintree and the Royal Liverpool and Broad Green. Two trusts are currently talking about the possibility of becoming a single organisation in the future. To make the proposals for orthopaedics possible, some ear, nose and throat services from Broad Green would need to move to Aintree. Doctors believe that this would be an opportunity to bring ear, nose and throat expertise together. some urology and general surgery services would also need to move from Broad Green. We think creating a single orthopaedics service for Liverpool would be better for patients and better for the local NHS. But before we make a decision, we need to know what you think. To find out more and to share your views, visit healthyliverpool.nhs.uk.